I think this is one of the challenges that we're all trying to get across, which is we want to ensure that participants that have a genuine need have their needs met, and then we're concerned about exploitation of the system. And I guess that's where my next series of questions are going to. Are the NDIA aware of any recent cases where illicit substances are being sourced or sold through the NDIS?
I'll defer to Mr. Dardo.
Absolutely. When you say through the NDIS, these are providers that are facilitating access to substances. Absolutely. I have spoken to very recently a participant who would meet the provider at the ATM. The provider would withdraw cash and provide that cash to the participant for her to source illicit substances. We have moved participants in some cases from those providers, only have the providers knocking back on the door to actually solicit them. We have had situations where we've involved state police in interventions to try and move people away from providers that are putting participants in harm's way. We have cases that are active that I will not talk about in the public domain, where the volume of the material that we've got in those cases is very significant. We're not talking in the dozens or hundreds of participants, we're talking significantly higher. And these are providers that are going out of their way to put people in harm's way. They've commoditised those participants and their plans.
What are we doing about those providers? So you talk about, in some cases, you've referred to state police, but you also mentioned that, you know, you've got these providers where you've taken the participant away from the provider is knocking back on the door. How is it after that experience that they are still a provider?
They're not. We've taken out the provider. We've wiped them out, or in some cases we actually have them in court right now.
Right, so they're coming back effectively as a drug dealer trying to sell. They're
coming through as a different provider, so a different entity, or they're buying other providers, or they are establishing other providers, or they're coming back as an unregistered provider. So there's a whole series of patterns. In addition to those behaviours, what we're seeing is that in some cases those providers are facilitating access to the scheme by facilitating fraudulent health reports with a view to actually creating a cash flow for participants that then are being moved into substance abuse.
Yeah, it's extraordinary. Would you have a rough ballpark on the number of specific cases that you guys are aware of?
Dozens.
Dozens?
And I'm talking dozens in the serious organised crimes level.
So not like, you know...
Nope.
This is significant, right?
Absolutely.
And in terms of what you've come to know, what types of illicit substances are being trafficked or sold or pushed?
You name it, it's on the list.
So heroin, cocaine, speed, ice, everything.
And these are providers that are there to do harm. And when I say providers, I'm using the word in the loosest possible way. Yeah. These are not genuine providers. These are not people that should be in business. These are not people that should be allowed near government schemes of any kind. And they're in partnership in some cases with health professionals, and those health professionals are people that we've either already taken down or are in the process of taking down.
I'm assuming the Minister's office would be aware of this situation. Yeah. We have someone that's come anecdotally to us to suggest that they've attempted to report these types of issues to the Minister's office and were then banned from calling the office, which is quite disturbing, if accurate.
Sorry, Senator. We can't comment on.
Yeah, no, my question was more to, obviously, there's not an issue with information flow between the department, between the NDIA and the Minister's office in relation to this issue with drug trafficking.
We receive referrals from the Minister's office every single day and from all members of Parliament that we take really, really seriously. Yeah. So we obviously try and refer as quickly as we can to state police, or we do our own investigation, or we work with our partners in the National Quality and Safeguards Commission. But we obviously absolutely act on any member of Parliament's concerns.
Yeah, and they're obviously, when those types of concerns come about, they're very serious, and I appreciate your transparency in speaking about it. So it was just to get a clear understanding that that is an open channel of communication. Have you any circumstances or information where participants have actually been physically harmed by providers or threatened with physical harm in relation to this drug trafficking?
I think there are certainly allegations that have been either referred to the Commission. We partner with the Commission when those sorts of events occur, but we also refer to the police where those allegations are raised. What I would say is that in many of these cases, these are some of the most vulnerable people in our society. They're people that should be getting much better protection from the whole system. I'm not just talking the NDIA, I'm talking the whole system. Look, the complexity here is beyond what I could describe in a short space, but to bring it to life for you, you know, we have parents that contact us because they're fearful for their relatives. We do what we can within the agency or in partnership with state police. State police will do whatever they can to remove the person from harm's way. But in some cases, that person is over 18, within control of their own decision-making, and may choose to go back in harm's way. We sometimes see the other end of that, which is really unfortunate for our staff and for all involved. Unfortunately, the dignity of choice also comes with the dignity of risk and the dignity of consequences, and it's heartbreaking to see it.
Yeah, it sounds heartbreaking. Yeah. Do you have any insights or in how we manage or what we can do better in order to effectively cut out this element of provider that is effectively criminal?
Prosecution is not the answer. It's too late.
Yeah.
We've got to get back to prevention.
Yeah.
So to get back to prevention, the scheme was designed with the best intent. Like, you know, you talk to anyone that was there at the beginning, there was a heartfelt design based on the fact that, you know, people with disability or the providers in that sector would never think to abuse the system. I think what nobody planned on was that when there's such a big pot of money there, that it would attract behaviours, it would attract risk, it would attract things that weren't there before.
Yeah,
right?
Yeah.
And so if we don't go back and tune the way the system is designed now, I can tell you now there is not sufficient judiciary to process the cases we have in the pipeline in the country. So we can keep thinking that prosecution's the end game. It can't be prosecution. We've got to get to prevention. Yeah. We've got to think more about, you know, how the money is flowing, what is the evidence that we require for somebody to actually receive the funds, how do we substantiate that it's being used for outcomes? And I'm not saying it should be harder. It should actually be easier for the money to flow, but it should be easier for it to flow to good things. And if a provider is dodgy or the service is dodgy, they should just not be able to play at all. And that requires reform.
And what kind of reform requires the ability for us to ensure that they don't get to play at all? And if they're playing, that we can get them out of the system really, really quickly?
It is...
Immediately.
It is... Look, this may be hard to hear, but I think it is outrageous that somebody can come in and claim $10 or $20 or $50,000 without a description, you know, or claim the entire plan in the first week of their plan. We need to actually fix the system so that substantiation or the descriptions are part of the design. Yeah. And we can do that, and we are doing that progressively as we move forward. Yeah. It is unreasonable that support coordinators can change the contact details for any participant they want, and in some cases the bank accounts of the participants they want, to make themselves the contacts, and then draw down $6,000 in a week for cleaning that probably didn't exist.
And they can actually take those funds into their own bank account.
They can take it into a related ABN if they want to, right? So it is unreasonable there are weaknesses in the design of the system that need to be addressed. We just cannot prosecute or audit our way out of this.
Yeah. Wow, thank you. I guess my next question, if I have time, do I still have a little bit of time, Chair?
Yeah, you do. You've got 6 minutes.
Thank you. Relates to individuals in the scheme who have interacted with the justice system and some concerns in relation to that. I think in March 2024, the NDIA confirmed there were 2,500 participants who had interacted with the justice system. Is that number roughly still the same now? Has there been any significant change to that number?
Yeah, hi Senator. Scott Norton, Deputy CEO of Service Delivery. The total number is 2,285 at last count that we have. Can I just qualify that though, Senator, again? We don't have ubiquitous data sharing with state and territories. I did make this point at the last hearing. CEO Ms Falkingham has written to every state and territory justice system under the powers of the Act to ask for that data.
Any luck? No.
Not yet, Senator. We remain very hopeful, and some states are willing to engage around it, but at this stage we haven't got free-flowing data. We rely on the good work of our justice liaison officers at the local level to capture that information.
Would you have then, with what you've been able to capture yourselves, information on the types of crimes individuals have been convicted of? And what we're trying to ascertain is around suggestions that there are some violent criminals or violent offenders, particularly of sexual assault crimes, who are able to self-manage their plans and then are recruiting, young women to work as carers for them who unwittingly accept that, not knowing that they're accepting a job as caring for someone with a history of a violent sexual crime. Is that accurate? Is that something that you guys are aware of?
Yes, Senator. What we're doing inside our Justice Liaison team and our dedicated justice pathway is to work with the state jurisdictions around getting really good data, not just a participant going in and out of the justice setting, but understanding why they interacted with the justice setting. So without that level of detail you go to, it's really hard for us to resolve for that. We are getting better. We know now that we have 143 participants that we've been advised are what we would call in the serious criminal offending space or sexual offenders. So with that group of participants, they're assigned to our justice planners, and there'll be a multidisciplinary approach with supports for those participants. They're led by the state justice systems, because if they're coming to community with a corrections order or if they're coming to community with requirements as part of some sort of supervision order, that's the role of the justice system. We're there to provide the disability-related supports, not the justice-related supports. That's that service system, but we need to work hand in glove with the forensic psychs, the drug and alcohol, the mental health, the NDIS workers, and work concurrently and jointly to make sure that we're doing our part from a disability perspective and they're doing their part from a justice perspective. So we're getting better at that, and we've got a dedicated team of very experienced planners with justice backgrounds, more highly qualified training and supports that our team put in place around our complex support needs team, and they're doing a lot of work. They also make sure that we're getting the right plan management type to address that issue you just raised.
And are they able to self-manage, the people, like say this 143 people?
All of those people are agency and or plan managed.
Yeah, so they can't.
We
they
make
can't
a risk call on that, and that's quite often part of their order as well. Because the orders might talk about the types of supports around them, and they would need to be registered behaviour support practitioners and so forth.
Okay, great. My other question relates to if someone is on a plan and then they become incarcerated, what happens to that plan while they are incarcerated?
Senator, the short answer is it depends on how long the period of incarceration is. You could go into remand for 2 weeks and we wouldn't adjust the plan necessarily. You could go in for 10 years and we have to have a look at what supports might be ongoing.
That makes sense,
You know, so it's a little bit depending on the unique circumstances. When we are advised that a participant is about to exit a justice setting, it might be time for us then to review the plan and say what supports do we need to get in place to get ready to transition to community. What sort of functional assessments, behaviour support plans, support coordination might the person need so they can reintegrate into community. So we sort of do transition planning on exit. On entry into justice, it just depends on how long they're in the justice setting for.
Would it be fair to say then if somebody is, say, on remand for something that they're waiting a hearing or a trial or whatever it is, the plan would continue, but if they were sentenced to a period of imprisonment, then the plan would not continue? Would that be fair and reasonable?
Depends, Senator. Every state correctional system is a little bit different.
Right.
There are significant restrictions on what services can be provided when a person is on remand, as you might be aware.
Yeah.
We are obviously much more able to have conversations with corrections staff when someone actually is sentenced and is in the system. We will obviously try and, as Mr McNaughton said, is to continue that certainty of support so that if a person, particularly we have a lot of straight releases in this country where people are released without any supports, and we know often they go on and reoffend in those circumstances. So we really kind of want to have that approach that supports have got continuity. When you consider right now that 1 in 4 people in corrections across the country has an acquired brain injury, obviously that 130 that Mr McNaughton's referring to is a small proportion of the number of people that are getting NDIS supports. Minister Shorten has announced the establishment of an external advisory panel, which we're really looking forward to, which will have forensic understanding, will have law enforcement understanding and disability needs understanding. So we can look at obviously all of our risk profiles and make sure we've got the right supports in place. But we are really, really focused on making sure that that when people are in community, they're getting the right disability services. So as a way of keeping community safe and hoping that they don't reoffend.
Senator, we are due to rotate at this point.
Just one very quick one then on notice is fine. Of the 2285 that have interacted with the justice system, if you're able to let me know how many of those on notice have a self-managed plan.
We'll take on notice what we can provide you, Senator, yes.
Thank you.
Thanks, Senator.
Thank you.